Hello and welcome to the Health Quarter. I'm Sophie Scott. On today's program we look at a major breakthrough in multiple sclerosis and whether a simple eye test can detect Alzheimer's disease. It's being hailed as one of the biggest advances in unlocking the causes of multiple sclerosis. An international group that includes Australian scientists has found almost 60 genes common to MS patients. They say the genes help explain why some people get MS and others don't.
Slow right down.
Sally Allen was diagnosed with multiple sclerosis when she was just 13. Since then, she's been hopeful of a major breakthrough.
I've been waiting 28 years and I'm still waiting, but I know they're getting very close, which makes me happy.
Scientists from the Westmead Millenium Institute looked at the genes of more than 9,000 people with MS and more than 17,000 healthy people. In a significant advance, they found that all those with MS had one thing in common: 57 genes that are exactly the same.
I don't know how long it will take to find a cure for MS, but I do know that however long it will take, that time will be shorter as a result of the discoveries in this study.
Researchers say the discovery provides new clues to the mechanisms underlying MS.
For scientists in the field, it is an enormous step forward. It isn't the end of the journey, but it is a remarkable milestone.
The genes were found in an area which governs the immune system.
MS involves the body's defence systems, the immune system, actually turning against itself. So this research should allow us to fight back more effectively.
At the moment, there are only a couple of effective medications for MS. It's hoped this genetic discovery will lead to new avenues for treatments.
A bit wobbly.
And that's also given new hope for patients like Sally Allen. The chilly winter months always provide some extra challenges when it comes to staying fit and healthy. We're more inclined to eat stodgy food and suffer from a general lack of motivation, meaning we might not do as much exercise as we should. But there are ways to avoid winter weight gain. Katrin Silarczyk takes a look.
The moon is still up and the temperature is way down. But this group is awake and ready to go.
Combination is going to be left, right, duck, right. Okay? Easy.
It seems they're well aware that an unfortunate side effect of the cooler months can be excess weight gain.
I think it's a combination of us eating more warmer comfort foods, takeaway foods, sausage rolls, pies, hamburgers, etc., and eating less salads and sandwiches that are made of salads. So the balance in the foods that we eat changes. And of course, we're less physically active as well.
While it might not seem so bad to put on a kilo or two, dietitians warn the side effects of vegging out could last well beyond the turn of the season, so it's important to make good choices.
It's nice to have warm foods, but how about having a nice warm bowl of porridge for breakfast and perhaps a nice warm drink but made with reduced or low-fat milk? So whether that's coffee, tea or hot chocolate, they're all fine, but use reduced fat milk. For lunch, maybe go for soups, cup of soups or fresh bowls of soups, rather than pies and sausage rolls and hamburgers. And for evening meals, things like casseroles are great. You can get the slow cookers that you put on in the morning. When you come home, they're ready and waiting for you, piping hot, and that will fill you up without putting on those extra grams of fat.
It's equally important to exercise during the cooler months, as taking steps to avoid weight gain is far easier than trying to shed unwanted kilos down the track.
We don't want people to go sort of train, get fit, and then stop and get unfit, and train and get fit and stop and get unfit. They find out over the year they'll just stay at the same level.
Trainer Andrew Stowe says keeping people motivated during winter is all about setting goals, working as a group and sticking to a routine.
We give programs like every 6 weeks where we actually set goals out and make them train towards that, so there's an actual outcome. That's a really powerful motivator for people, and also make them accountable to each other. Give them buddies to train with, and training as a group, they're accountable to each other.
It's not easy, but these people believe it's well worth it.
You kind of pay for it with you're drinking your hot chocolates and eating warm comforting food, so you've got to burn it off sometimes.
It's pretty hard when the alarm goes off and it's really warm and you kind of think, but I think once you get in the habit, it's kind of almost addictive.
Really important, I think, in the winter. Everyone wants to look good naked on the beach, I guess, by summer, so it's a good time to keep under wraps and get fit.
I think it's even more important to exercise in winter because it's so cold, and if you can exercise in winter then you can do anything in summer.
And sometimes it's simply a case of mind over matter.
It's much easier to be sensible during the winter periods so that you don't have to go through that difficult challenge at the end of the year.
So if you can prevent gaining your winter padding, you won't have to worry about losing it come summer.
New research has found that serving in Vietnam had a devastating impact not only on the soldiers but also on their families. The wives and partners of Vietnam veterans suffer much higher rates of mental health problems than the general community. Richard Rowe was conscripted and served 12 months in Vietnam. His wife June says for some families living with a veteran can be challenging.
The wives and the children have ongoing problems, often for many, many years. It's like a ripple effect in a pond.
And a new study backs that up. Interviews with veterans' wives found they're suffering mental illness at levels 20 or 30 times higher than the general population.
Initially I couldn't believe it, and I repeated the calculations over and over and over. But when I kept getting the same result, you have to stand back with your arms in the air and ring alarm bells.
June Rowe believes that some of the problems stem from how soldiers are trained.
There's a great deal of lack of intimacy, as far as I'm aware, including myself. The boys are trained to, carry on regardless, even if one of their mates has been killed alongside them.
Study author Brian O'Toole found the wives of veterans have significantly higher levels of depression, panic attacks and anxiety disorders.
More than 50% of the wives have had a history of major depressive disorder, and that this history of major depressive disorder is related in our data to veteran combat.
June Rowe isn't surprised, saying many wives are trying to help their partner deal with mental illness.
They suffer sometimes very high degrees of anxiety, and it's very difficult living with someone like that. You often feel like you're walking on eggshells.
Researchers will now turn to the fate of veterans' children to see how they've been affected. There's been a scientific discovery that could prevent viral diseases such as HIV and pave the way for new cancer treatments. Australian and German researchers have created a new molecule designed to block viruses from entering cells and spreading. Rebecca Barrett reports.
It's been a 4-year effort, but those involved aren't getting carried away with their findings or the potential implications.
It's an exciting scientific discovery, yes. Is it a medical breakthrough? That remains to be seen.
Researchers have created 2 new molecules named pit stops that stop viruses entering the body and spreading. The pit stops work on a protein called clathrin. It creates pits in cells that viruses hijack to infiltrate. By inhibiting clathrin, the virus can't take hold.
It's surprising the range of viruses that utilise pits to get into cells. Ebola virus is one, dengue fever is another, Hep C.
Australian and German scientists tested the effectiveness of the pit stops against HIV. They also found it can stop cell growth and division, and that has implications for cancer.
It gives hope that the various pieces of the jigsaw puzzle, particularly around cancer, will eventually fall into place and we'll come up with a series of very effective treatments against cancer.
So what is it, Liam? What are you drawing?
That's reassuring for Sonja Malcolm, whose 11-year-old son Liam was diagnosed with leukaemia 2 months ago.
The treatments are really harsh and the kids, whatever can make it easier and more effective on the kids is always going to be better for them.
The next step is to fine-tune the pit stop molecule to ensure it can be safely developed into effective drugs to tackle a range of diseases. But clinical trials are still 5 years away. Good medicine worth waiting for.
A simple eye test could help detect Alzheimer's disease before memory loss and other symptoms develop. Researchers have found that the width of blood vessels in the back of the eye is significantly different in people with dementia. These days, brain scans can pinpoint which patients might have the first stages of Alzheimer's disease. While it's accurate, it's also time-consuming and expensive, so doctors in Perth have turned to a simple eye test for clues. They compared the retinas of patients with Alzheimer's with those who had mild brain impairment and those who were healthy.
So the pilot study shows that the blood vessels of the eye and the retina, they are thinning. So we see a significant change, actually a reduction in the size of these blood vessels.
They believe that the toxic protein which builds up in the brain of Alzheimer's patients also collects in the eye. Imelda Davies struggled with her memory for 2 years before being diagnosed with Alzheimer's disease. She says an early diagnosis would have made a big difference.
Instead of big question marks, I was trying to keep to myself without making myself sound like, one of these old biddy's getting older. Can't remember the day or the date.
Doctors say the eye test could be used in conjunction with blood tests that can pick up changes associated with Alzheimer's disease. Australian researchers are now testing 1,100 people to see how reliable the blood and eye tests are.
It's non-invasive, and you can extend it to the wider population, which will be a very nice, simple screening test.
The latest findings will be presented at the Australasian Conference of Anti-Aging Medicine. A system under strain and diagnosis lost in translation. A study of how hospital staff deal with emergency patients has found communication breakdowns can potentially harm patients. Philippa McDonald reports.
The study found in the race to make an urgent diagnosis and provide emergency treatment, effective communication can suffer.
What doctors often say is they don't have time to attend to the interpersonal, to develop rapport and empathy with the patient.
Researchers observed and recorded doctor-patient consultations in 5 hospital emergency departments over 3 years.
If you do develop a relationship with a patient, you ask them what they think's wrong, why they're there, you listen to their story, we're arguing you get a much more efficient diagnosis more quickly.
Health consumer groups say it's symptomatic of a system under severe strain.
This is a very big wake-up call, because what this study indicates is that we are really compromising the quality of care that Australian consumers are getting if we don't address some of the problems around the pressures that are on the hospital system.
Senior emergency doctors say the heavy burden of responsibility rests on those with the least experience in patient care.
I would say that it's crazy to staff the emergency departments of our hospitals with the most junior medical staff.
Emergency medical practitioners say they're in favour of the findings, which call for major changes to communications practices. And researchers are now looking at more high-tech ways to manage handovers.
Having an iPhone app where you can walk down the corridor and where the informal handovers, as you're talking on the run, can get recorded and then centralised through a database.
Too stressed or too busy may no longer be justification for a breakdown in communication.
And that's all for this edition of the Health Quarter. For more health news, follow me on Twitter. Just search for Sophie Scott, and I'll see you next time.